Good afternoon, everyone. My name is Verushka. I'm studying biomedical at Ines Wengeri. I present Outlet Immunology assignment by Dr. Xavier. So I have 4 questions I'm going to present to first. The first question is, how are antiserum produced and what are their application? Antiserum involve red thin serum that contain antibodies specific to certain antigen. This process is commonly used in immunology and clinical diagnostic for applications such as treating venous bite infection or immunodiagnostics purpose. So first of all, we have selection of antigen, selection of animal host, immunization, blood collection, antibody purification, testing and standardization, storage and distribution. Application of antiserum. For that application, we have therapeutic use is the treatment of venous bite like snake, scorpion, or toxin-related infection like tetanus. Diagnostic identify pathogen or specific protein in immunoassay like ELISA or immunofluorescence. Research studying immune response or creating secondary antibody for immunology. The second question is, what is the significance of monoclonal antibody in immunoassay? First of all, we have high specificity. Monoclonal antibodies are high specificity because they are produced to target a single epitope on a specific antigen. These characteristics make them valuable for both diagnostic and therapeutic application. The reason of high specificity is original from single clone, single epitope recognition, genetic engineering, controlled like. The second reason is diagnostic power. Diagnostic power refers to the ability of a diagnostic test or tool to accurately identify the presence or absence of specific disease or condition. It reflects the test's overall effectiveness in distinguishing between healthy and disease states and is determined by several key. We have sensitivity, specificity, negative predictive value, accuracy, and so many like. We have therapeutic potential. Therapeutic potential refers to the capacity of a treatment or intervention to successfully alleviate or cure a disease, improve health outcome, or manage chronic condition. In medical context, this term is often associated with therapy like drug, monoclonal antibody, gene therapy, and medical devices which show promise in treatment specific disease or condition. The factor influencing therapeutic potential is mechanism, action, efficacy, safety, target population, durability of response. So we have 3 questions is, how does immunoprecipitation work and what is application? Immunoprecipitation is the widely used laboratory technique that allows to isolate and analyze of a specific protein or antigen from a complex mixture. using an antibody. The technique is based on the principle of antibody-antigen interaction, which enable the capture and subsequent analysis of target protein. So the application of immunoprecipitation, we have a protein-protein interaction studying protein purification, post-translation modification, antigen detection. Advantage of immunoprecipitation is specificity, versatility, sensitivity. Types of purification. So we have purification. Purification is in the context of biochemistry and molecular biology refer to the process of isolate of specific substance, typically of protein, nucleic acid, and other biomolecules from a complex mixture. The types is protein purification, DNA, RNA purification. We have also interaction. Interaction refers to the mutual influence or relationship between two or more entities, often leading to a change in the state, behavior, or function. So the last question is, what is immunocytochemistry and how it performs? Immunochemistry I have 3 points. The first point is visualization. Is the technique used to detect and visualize specific protein, antigen, or other biomolecule in isolate cell using antibody and image method. The antibody are targeted with label along the target to be visualized under and microscope. The step is sample preparation, permeabilization, blocking, primary antibody incubation, secondary antibody incubation, detection and visualization, contesting, microscopic and image. The second point is procedure for immunocytochemistry. The procedure for immunocytochemistry involves a series of steps to detect and visualize specific protein or antigen in isolate cells using label. Antibody below is a delayed guide. So we have cell preparation. Permeabilization is like visualization, blocking, primary antibody incubation, secondary antibody incubation, contesting, mounting, visualization again. We have the last point is application of immunocytochemistry. Immunocytochemistry is the powerful technique used in research, diagnosis, and therapeutic development due to its ability to detect and visualize specific protein or antigen in individual cells. We have research application. In research application, we have protein localization and function, cellular pathway and mechanism, co-localization study. 2, we have diagnosis application. Diagnosis application have cancer diagnosis, infection, disease diagnosis, autoimmune disease diagnostic. 3 is therapeutic application. Therapeutic application have drug development, biomarker validation, gene therapy validation. We have also 4, cell biology and development study. For example, we have trunking stem cell differentiation by visualize lineage, specific marker. That is the whole step of my presentation. Thank you for listening and have a good day.